My name is Dr. Robbie Harriford. I'm the Chief Medical Officer and one of the women's health providers at Samuel U. Rodgers Health Center, which is in Kansas City, Missouri. We are a federally qualified health center. The majority of our patients are refugees and immigrants. About 60% of our patients are best served in a language other than English. We decided to prioritize working with Upstream because honestly, it came straight from our patients. We've always provided contraception, but the process itself wasn't streamlined and it wasn't always as beneficial for our patients in terms of the timeline. So for instance, there were some cases where patients were having to wait over a month to get an IUD. You hear that over and over, you start to think like, what can we do differently? The challenges within our health center the biggest one was our billing. We were billing, we just weren't capturing everything that we needed. And so that was one of the biggest things that I wanted to work on with Upstream. And I think also just knowing that our patients weren't feeling as satisfied with the care because they were having to wait so long, I wanted to be able to come up with a way that we could provide same-day access. And so those are the two biggest points that Upstream really helped us with. Working with Upstream has literally been a dream. It's been incredible. They initially, with our first team, sat down with us to walk through what it is that we were wanting, what it is that we were missing, what it is that we're actually doing great, because they wanted to be able to kind of tailor what we're doing to include some of the good things that we're doing, but also if we needed to tweak things. They sat down in each department. So it wasn't just with us as providers, it was with our staff that's doing the rooming. It was with our billing department. It was with our director of clinical operations. And they sat down with everybody to get an idea of what we needed. And then we collectively came up with a plan to move forward with what we prioritized. So the impact, especially with staff, and this is actually one of my favorite things that has occurred because of Upstream, is that our staffs, our MAs and our LPNs, that room that kind of helps start the conversation, they are feeling so much more empowered because they are active participants in the visit. They're not just taking blood pressure anymore. They are starting that conversation and they've had that training to feel confident, and you can just see it in their face. Like they love being a part of it and they're actually working at the highest level of their licensure. You should work with Upstream because they are phenomenal. They work with you. They aren't trying to tell you what to do. They really look at your health center or your hospital or whatever program you have, and they want to make it work for you guys. So I say, run, don't walk. Please work with Upstream.